Dr. Burton.
And I'm also Dr. Burton.
And it's been a while since we've done a video, and we've always said we're doctors, but we've actually never said what kind of doctors we are.
So I'm a consultant ophthalmologist.
And I'm an epidemiologist who works for a pharmaceutical consulting company, formerly a public health epidemiologist.
So the 2 metre rule, we have to adopt a distance of 2 meters between ourselves and the next person that's out there outside of our particular household.
Right, so this is probably one of the measures that I am most probably unconvinced by. From my understanding and from what I've found is that they've shown, at least in lab settings, that particles can travel up to 2 meters, and there's probably research that suggests that it could potentially go even further. What I question around that is, that's a lab-based setting, so that doesn't necessarily translate to the real world. But even if it does, there's always a sort of dose response. So would passing by somebody on a street, if you were less than 2 meters and all they happened to do was breathe, how likely are you to catch a disease really, as opposed to maybe sitting in a room with them for 15 minutes where you are having a discussion and, there is a lot of breathing in and out and, potential things flying out your mouth. To me, those risks are not equivalent. There's definitely a time component, which I don't really think has been thought through.
So I think the message is clear. Standing away from persons outside of your household, 2 meters. That's the government initiative. I think it's a simple message. I think that simplicity is to protect those most at risk. But the nuances of it that you've discussed there, I would tend to agree with.
Well, I try to go out once a day and have a run in these times because there's nothing else to do at the moment. And I've seen people running in the middle of the road trying to be 2 meters away from other people, but then they risk getting hit by a car. So we've got to think of the practicalities around that. So that's where I do query the implementation of this 2 meter rule. I definitely think there's a lot of nuance, and maybe this is public health for the masses or by public opinion. The effect of being in an isolated state, there's lots of research around people who've been isolated, lack of especially physical contact for extended periods of time. It can lead to increased depression, anxiety, other long-term conditions, general deterioration. That in and of itself can contribute to very poor health and even death as well. So in trying to mitigate one problem, COVID, we could be creating a whole host of other problems that might not necessarily be as acute.
Age concern, I've already highlighted the fact that loneliness outside of COVID is a serious thing to consider, especially in the elderly population. And my feeling on it, just in the short term, is that in patients that instead of coming to my clinic and I've called on the phone, they've been really thankful for me just having somebody to talk to on the phone, outside of their medical problem at hand. So, and that's just in the short term, the past 3 weeks. I don't know what the action plans are for it. I know that there are agencies out there looking into that particular aspect, but it's a slow burner, and it can have quite devastating effects on particularly vulnerable people.
Probably about a day before the latest lockdown measures were implemented, groceries, the liquor aisles were completely empty. So we might not be getting coronavirus, but I would suspect. And how long does liver disease take to develop?
Yeah, and I've noticed I think off licenses are open.
That's apparently an essential service alcohol. I don't know why. Well, I mean, I could see why you might need to drink to get through this, but
probably not the best for physical health, mental health, and also for domestic violence. I think we should try and restrain the amount of alcohol intake for sure during these testing times. It's turning to booze is not something that anybody should really do at this moment in time, or otherwise, but especially now, given the fact we're all at home. Sorry, it's my medical message.
Okay. Okay, I think that's a bit preachy.
Well,
okay. Right. Another COVID problem. How not to eat down your ice. Now, there was a lot of talk about people panic buying just everything, food. On reflection, that might not have been panic buying. Especially if you have a child. My child, we now live our lives in units of food. So essentially, we're living for our next snack or our next meal. How big are we going to be? Like, I mean, I might not even be wearing trousers, guys. You don't know. But on the odd chance that I might be. So definitely not trousers of a restricted fabric. It's all spandex. Spandex is very forgiving.
which is why the exercise matters.
Yeah. So yeah, just if you know how to not eat down your house while you're on lockdown, I would be very interested to hear. You go to work, so your sort of life, your routine has not been upended to the same degree that mine has. But yeah, I'm scared to get on the scale.